Hello everybody, this is Sean and posting this video 48 hours post surgery for cryoablation. Um, Reason being I was diagnosed December 2017, which is 4 months ago, with atrial fibrillation. And I watched dozens of videos on YouTube and found it very helpful in making my decision. Um, I actually had the first bout 3 years ago. I was on an airplane, and by the time the airplane landed and I got in the ambulance to go to the emergency room, I was back in sinus rhythm already. So they wrote it off as anxiety attack. I did a stress test in the hospital the next day, and uh, they never seen A-fib, so they just called it anxiety attack. Happened again December, 3 years almost to the day later. Uh, Went to urgent care. As soon as they hooked me up to do EKG, they saw right away that it was atrial fibrillation. While I was in urgent care, I got up to use the urinal, and my heart rate spiked to like 200 beats per minute. So they called 911 in urgent care and sent me to the emergency room. And uh, at that point, I stayed in there. This all happened at like 12:30 a.m. and I stayed in A-fib till 3:30 the next afternoon. So um, yeah, it lasted almost 15 hours in A-fib. Um, After that, they put me on the metoprolol, which already had a bradycardia anyway. My heart rate was slow. So they put me on that as well as digoxin, which really slowed me down. So it was, I couldn't function good. With all the medication and stuff, it wasn't for me. And talked to my cardiologist, and he wanted me to stay on it because the medicine was working, but I was taking two blood pressure pills, metoprolol, digoxin, uh, amiodarol, something like that. It's a real powerful rhythm controlled drug for AFib. And it was getting the best of me. Um, and if I didn't take the medicine on time, I would go through a bout where my heart rate, I could be sitting at dinner and my heart rate would go up to 100 or over 100. And I have to get to my metoprolol to get it back down. And doctors was thinking that maybe it was in my head the way it was happening. And I can't say that it wasn't, because the fear is there once you experience AFib, especially with SVT, when you go into heart rate spikes so high. Um, the fear is there and the fear is real, and I didn't like it. So I started researching, doing all my homework, watching videos, reading, and um, a friend of mine that's a cardiac surgeon in Memphis, I called him, and he suggested that I go see electrophysiologist. Um, I got HMO, so I asked my doctor about it, and he didn't agree. He said the medicine's working, don't worry about it. So my friend told me to demand a referral to see an electrophysiologist. I did, and I got one. My mom had atrial fibrillation. She just had she had the cardiac conversion, and just a month and a half ago she had a cryoablation, and she's still in her blanking period, so can't tell if it's a success till the 3 months. But so far so good. While I took her to the hospital to have hers, because she didn't know I had AFib, she's a worry wart, and I didn't want to worry her. I talked to her doctor while I was up there before he did her surgery, and he agreed with the things I was saying about not wanting to have the stress, the fear of going back into AFib and taking all the medications. I wanted to eliminate that, not put a band-aid on it. I wanted to, exonerate myself from the AFib. So he agreed to do the surgery, and um, had a MRI, a cardiac MRI, so he can see everything. And he got me in there, and I had the surgery 2 days ago, and now I'm home in my bed. Um, with with atrial fibrillation, it's anxiety and it's fear that's just going to be there. after experiencing it. And after taking my mom first and saw how smooth her surgery went, I saw her day in and day out since the surgery, and she recovered well. Um, I was comfortable going to get it. I wasn't too nervous. I'll be lying if I said I didn't have a little nervousness, but I was comfortable. Um, Arrived at the hospital at actually I had it done at Illinois Masonic Hospital. Arrived there at 8:30 a.m. Uh, Set to go into the room at 10:30, but wound up going in at 11:30. Um, they hooked me up with a lot of cold leads, paddles, just in case if something happens while you're in there. But no worries. They asked me what type of music I want to listen to. I told them smooth jazz. They put that on. They're getting me prepped. Doctor come in. They did a timeout to make sure they was dealing with the right patient. And she told me that she was going. They agreed that they wasn't going to do the general anesthesia with the tube down my throat. They call it TE. Um, so I was happy about that. I didn't have to get the tube down my throat. She told me she was going to put a little something in my IV to, get me in like a twilight or whatever. And I remember her saying that. And the next thing I remember them walking me out of the surgery room to recovery. I had to lay on my back flat for 4 hours, which I thought would be the worst part because everybody say that that's the worst part of it, which that wasn't even that bad. Because you're still a little spacey from the whatever the anesthesia that they do give you, the twilight that they give you, and you're talking to your support group family who's over there. And 4 hours went quick. I watched TV while I was waiting, and the doctor that I use, which everybody I see in every video I see, everybody stays overnight, and they go home the next morning. The doctor I use, he said you rest better at home. So if everything looks good, he let you go home the same day. I got my release papers and everything, discharge papers, and stood up to go to the bathroom. Came back, they was taking my IV out and everything, and started getting dizzy and woozy, and I had to lay back down. So they admitted me. They called him and they admitted me because of that. Because at the end of the procedure, he saw there was some fluid around my heart, and he wanted to see that the next day. So he wanted me to get a ultrasound the next day just to see and make sure that it wasn't anything extra, that it was the same. And so I stayed overnight. My wife stayed at the hospital with me. Um, they made it comfortable as they could for us. Came in the next morning to do the ultrasound. The doctor was there while they was doing ultrasound. He looked at it while they was doing it, and he agreed that I was able to go home as long as I felt up to it, which I did. I got up and walked the whole floor of the hospital. I walked like a cowboy, but I was able to do it, and I'm home. Uh, when I saw several people talk about the elephant on your chest, my mom didn't have that, but I do. Uh, it's real for me. My mom's surgery lasted, or the procedure lasted 2 hours in the OR. Mine was 3 hours in the OR. So I don't know if it was because of more time, but the fact that they are inside your chest, healing stuff, moving around. So it's not a pain. It's pressure. When you take a deep breath, it's more so tolerable. You can deal with it. I'm a worrywart myself, and I was worried that, I hope I didn't feel like I'm having a heart attack, or how would I be able to tell the difference? And nothing like that. It's tolerable. You deal with it. Like I said, this is 48 hours afterwards. Taking the anti-inflammatory medication, Colchicine, I believe, is what it is. Um, but here I am. Can't tell if it's a success for another 3 months, but um, took the first step and rid myself of A-fib and the fear that comes with it, and I'm looking forward to what these next few months have in store. Um, got a vacation booked in 4 weeks for going to Mexico for my anniversary. I'm taking the family. The doctor said it's fine. Um, 5 days being still. Um, 2 weeks taking it easy. Back in the gym in 2 weeks. Well, not back in the gym. I'm going to the gym and start working on me. I've been juicing before the surgery. I lost 21 pounds juicing. Um, and I'm going to continue to do it till I get to my goal and get back in the gym and work out and get off some more of these pounds and get myself together and start working on me. I had a lot of factors to contribute to A-fib, being obese, overweight, high blood pressure, uh, sleep apnea, uh, drink occasionally, a weekend drinker occasionally, and a cigar occasionally. So all these factors contribute to A-fib. So I'm eliminate some, and but I definitely want to work on me. And the biggest thing is getting the weight off to get the blood pressure under control. Which I was on 2 pills and I'm already off one from juicing, and I kind of took myself off both, but my doctor wanted me to stay on the lisinopril. He cut it in half because he said that helps in restructuring your heart and getting your heart together. So for the time being, I'll be on 2 milligrams of lisinopril daily. Um, but this, my goal is get off the Xarelto um, with the ablation. If everything is fine, he'll take me off of the blood thinner and get in that gym and work on the new me. Got little kids that I need to be here for, so I got a lot to do on my end. But hopefully the relief, the stress will be gone from the A-fib, that fear, and I can move forward. So what I can say is the worry warts. You're deciding whether you should or not. My experience 48 hours afterwards is to do it. Uh, don't put a band-aid on it. Get rid of it so it's not remodeling your heart. Get yourself together. Get rid of the triggers and stuff that can cause it, and just put your best foot forward. It's surgery is not bad. The ablation was not bad at all. Um, I'm in a recovery phase. I can walk. Um, do have a little tightness, and this is 2 days afterwards when I take a deep breath, but it's very tolerable. Um, from when they went inside me, when I looked earlier today, no bruising. It's too small, like incisions. Um, it's nothing. I know I saw people saying that they were very bruised up. Hell, maybe in another day or two it might get worse, but as of now, nothing. No pain. I mean, I could feel that they did go in there, but it's no pain. Uh, yeah, I'll come back, add to this, or I add a part two to this, maybe 7 or 14 days afterwards. But 48 hours afterward, I got the remote control in my hand, watching TV. My wife and kids are waiting on me, even my mother. Yeah, I suck it up when I can, huh? But if you have an AFib, get rid of it. Don't put a band-aid on it. Take those meds forever. Get the ablation. Move on with your life. Sean, and I'm out. Peace.